first thing that went through my head was like, I need oxygen.
It's not every day that someone gets attacked by a shark here in South Florida, but the odds are definitely not zero. Shark Week may be over, but you'll want to hear this story. Welcome to On Call Off Script, the Jackson Health System podcast. I'm your host, Ruel Champion. Joining us today are a number of experts, a number of patients. So can you please introduce yourselves, each of you, and tell us your titles?
My name's Kevin Blanco, Miami native, shark bite survivor.
Yeah, we're here for you today.
Yes.
Omar Blanco, I'm Kevin's father, and I'm also a firefighter, captain with Miami-Dade Fire, and also state representative here in the great state of Florida.
Antonio Marttos, a trauma surgeon at UHealth, Jackson Hospital, Ryder Trauma Center.
Right, and we're on the cusp of Shark Week. One thing that we kind of talked about pre-conversation is that shark bites are not very common, right? So, Kevin, tell us your story. Where do we start with this experience?
It was a beautiful Thursday day, out in the Keys, down in Marathon, hanging out with a couple buddies, going to do what we do all the time, regular spearfishing day. This happened a couple times a month. Whenever we were able to get free, let's go spearfishing. And it was a beautiful day. We had shot some fish. We were out there doing what we wanted to do. And we were coming up towards our, last bit of it. And I'm like, I'm going to make one more dive before we get out of here, Head down, I see a huge Cubera snapper, fish that any spear fisherman knows is like the trophy.
Right.
And I take a shot, fish starts going crazy, he gets stuck in the rocks. I'm like, you know what, let me come back up, I'm gonna get another breath of air and we'll work the fish out later. Get my buddies around, tell them like, okay, there's a fish here, let's see what we can do to get this fish out as quickly as possible. Obviously we're in 72 feet of water, so we're deep, you gotta have a game plan before getting down there, kind of everyone, making sure everyone's on the same page.
And so at this point, Kevin, you had already speared the fish, and the problem now is bringing him in. So he got tangled in the rocks. We're kind of, again, getting a game plan, seeing what we could do best down there. Obviously, you can't communicate while you're down there, so it's all hand signals and planning. So kind of like, all right, you're on shark duty, I'm going to grab the fish. And then I had another buddy who was kind of in the middle of the water column, just getting a bird's eye view of everything. Breathe up, do our thing. Start heading down and kind of seeing where the fish is at. My buddy, Danny Maduro, 10 feet away from me the entire time. Water had started getting a little bit murky, but not, too bad. I get onto the fish. I see that the fish is laying this way and the spear shaft is laying this way. So I'm like, okay, I'm not going to be able to get him out this dive, kind of situate this, go back up and get another breath. As I'm laying on the floor, I push off the rocks to start heading back up, and out of nowhere, just a 9-foot bull shark just came in and hit me as hard as hit me. More of like a hit. He hit me as hard as he can, while obviously leaving a bite. First thing that went through my head was like, I need oxygen, obviously. So I yelled. I lost a lot of my air. I could already see like blood coming out, and I'm like, whatever. We shoot up to the surface. My brain is going at 1,000 miles an hour. I mean, as you can imagine. I was about to say, but give yourself some credit, because we talked a little bit before, and you mentioned that you kept things really cool and cucumber-like before the lights showed up.
Exactly. That was kind of like my adrenaline, kind of like
a lull.
Yes, working as in like, okay, if you freak out and panic, and you start losing your mind, like the situation can get a lot worse.
Right.
So as I shot up to the surface, my buddies helped me up by like carrying me by the shoulder, helping me up, and start swimming to the boat. I get back onto the boat.
Right.
And now there's just blood everywhere, blood spraying over the engines into the water like a sprinkler. And, I kind of like told my friends like, hey, listen, we need to put a tourniquet on this immediately, as soon as possible. Obviously we didn't have one on boat, which now we don't leave the dock without one.
That's right. And Dr. Marttos, I see you nodding your head like, tourniquet, check. They put it on. Absolutely. What goes through your mind when you hear stuff like that? When you hear that they didn't have the tourniquet, but they knew that they needed to stop the bleed?
First is every time you have a trauma, right? You're not prepared for trauma, because you not go away doing sport or drive your car or go to work, I'm going to have a trauma today, right?
Yeah.
So a lot of prevention is about learning what to do in an emergency situation, right? And like you said, when you have a boat, when you do this kind of sports, so it makes sense to have like an emergency kit and tourniquet.
Yeah.
If people going to have an emergency like that, can make you die, it's because of bleeding, right?
Wow.
Most of the time, this situation. So having a tourniquet or know how to, the principle of stop the bleeding makes a lot of sense.
Right. And it makes all the difference, like you said.
And he knew it. And then that's what I think that's what make a difference for his prognosis. Yeah.
That's incredible. Yeah. So keep walking us through.
So yeah, took off
I'm sure you weren't walking, but.
No, yeah, laying on the floor, but kind of took my weight belt off, you know. Told my friends, like, hey, listen, we need to tie this on my leg as tight as we can and then work our way in. You know, started to see the blood slow down. I knew it was tight. I obviously felt that it was tight, and we then cut the anchor, called 911. We're on the phone with them, kind of like explaining either where do we meet or what's going to happen. Yeah, what's next? Do you want us to head in, or are you going to have someone come out to get us? You know, that's obviously all of this is happening at 1,000,000 miles an hour. So stressful for my buddies, stressful for me. Like, we obviously just want it to be.
This is not what you walked into.
Yeah, no.
Yeah, no.
So start heading in. They tell us meet us at Sunset Grill, which is the restaurant at the end of the 7 Mile Bridge. And right after that, I tell them call my dad. So my dad, you know, kind of has an idea of what's happening, but not. I don't want him to freak out and be like, by the way, your son's on a helicopter, like right now. Like, so I told him, give him a call. And he didn't answer.
Omar.
And then we called him again.
I was working.
That's very true.
And then I called him again, and then he also didn't answer. And then called him a few times, and then he texted. He was in a meeting. He's like, is this an emergency?
Right.
My buddy responded with yes. I don't know if you want to explain.
Yeah.
Well, I mean, you've seen plenty of things.
Sure.
So talk us through learning what happened.
Yeah, so a couple things. You know, it's interesting as I'm hearing him say the story.
Yeah,
I've got this version in my own head. You know, because I talked to the kids who were with him, 2 boys, amazing guys, and as I'm going through this thing, you know, the tourniquet. It was something as a firefighter I talked to him about often. I was like, hey, you like to go hunting? You like to go fishing?
Yeah.
Emergencies happen out there. There's not a 911 readily available also, because if you're hunting, they take time. If you're out in the water, they take time. But I was actually working that day on the fire department, and we were doing believe it or not, we were doing a training on active shooter. So if you could imagine, it was basically to replicate a mass casualty incident. Where someone came in with and we were actually applying tourniquets to dummies as we're going through this thing. So something we train on often. You know, the thing about our profession as a firefighters and, you know, as a doctor in emergency medicine and trauma is, you know, when we go to do the jobs that we do, it's because we've trained so much, it's second nature. We don't have to necessarily think. I'm sure the doctor would agree with that. But, you know, the interesting thing was we had just finished, and the thing was, I was in charge of the operation, the training operation.
Yeah.
They had assigned me to be the head of the operation, and so I ran through it. I was command. We saved everybody. It was like we were in the classroom.
Every mannequin made it home safe.
And this was made out of. It was a room full of police officers and firefighters, probably about 40 to 50 of us. And I just got back, and I look at my phone as I'm about to sit down, and I see 5 missed calls from a number I don't recognize. Now, 5 missed calls get your attention. So I didn't know if it was an emergency necessarily that was my emergency or somebody else's, but I immediately said, hey, is everything okay? You know, I said, is there an emergency? And they wrote, yes. So in the classroom, because I didn't want to get up, I pick up the phone, and all I hear is a kid screaming in the background.
Oh, no.
Omar, Kevin got bit by a shark. Kevin got bit by a shark. So I get up right away. I'm in this classroom. The head instructor's like, Mr. Blanco, you can't just get up and go. And I'm like,
not when it comes to my kid.
Not right now. So he was alarmed because he knows me, and he was like, But all I could ask the kid was, hey, where did he get bit? Because I think ultimately that is vital, right? Yeah. I would have known right away what I was dealing with. So I asked him a couple times. He's like, I can't hear you. So I kept screaming it louder and louder. Yeah. You know, and then And the instructor came out. He goes, "Hey, what are you doing, man?" I go, "Hey, my son got bit by a shark. I have no idea what's going on."
Yeah.
And then they turned into like operation mode. What do you need us to call? So what I did is I said to him, I go, "Hey, man, and then at some point I go, "Hey, is he alive?" Like, and then screaming, but he couldn't hear me. So all he said was, "Hey, there's blood everywhere and his eyes are open."
Okay.
That doesn't say much either.
Yeah, no.
So look, I said a prayer. I told him, "Hey, get my son to shore," and I hung up. I'm sure he couldn't hear me, but I knew I had to hang up and get on the phone. So I was the president of the firefighters for many years. I worked with I've worked with Jackson Hospital Systems. I worked with everybody. One of the first people I call is from the government relations people. I'm like, "Hey, my son got bit by a shark. He's in the Keys. I don't know where. I'm obviously gonna get him your way. Help me out. Tell me what we can do." And they started making phone calls. I called my fire chief. I called everybody I had knew in emergency services, try to get the right people on the call, and to make sure that I was at an army of people helping me guide.
Right.
It's my profession. It's how we operate, right? Mm-hmm. And so it was good. At some point, I decided to leave, but I hadn't spoken to them again. And about 30 minutes later, I get a call back from the kid. "Hey, we made it to shore." And the first thing was, "Hey, is Kevin alive?" And he goes, "Yeah, he's talking to the thing." "All right, check. Good. This is good. We're moving in a better direction." And the rest was just, getting him to Jackson. I was there when he got there, and in the fire service, when someone jokes around in a serious situation, it is a great thing, and in the sense that you feel like if you're not joking, there's no room to joke, right? But if you crack a joke, and I say that because when the helicopter landed at Jackson South on the helipad, I don't remember the guy's name, but I know he was a big guy with like long hair, long curly hair, and he opened the door. He goes, "You must be Dad," and I was like, "Check. That's a good sign."
Yeah.
And he said,
but it's almost like, I hate to interrupt you,
no,
but as you're telling this story,
talking.
you're going through this checklist in your head, and do you feel like you developed that over your span of your career? Of
absolutely,
here's what I need to do first, here's what I need to do next, and you applied it. Do you feel like you applied it seamlessly when it came to Kevin?
I applied it better than I thought I would. I think that would be the thing. So the very chief that was having the class, like a month later, I ran into him, and he's like, "How's your son?" I'm like, "Oh, thank God, he's good." And I'm like, "Bro, I apologize if I might have said something inappropriate in the class." Like, honest to God. And the thing that got me was, he said, "Omar, if anything ever happened to my kids or my grandkids, I hope I can be as controlled and in the same mindset that you were."
Wow.
And then I told him, I said, I was pleasantly surprised as well, but I knew if my son had a chance to live, I had to take advantage of every opportunity. Because the one thing we know about these types of calls is if one thing goes wrong, it can have a bad turnout. But as I said back then, and I still believe it to this day, everything that could have gone wrong that day went right. And so for that, we're extremely grateful. And one of those being Dr.
I was about to
himself.
say, you should be proud.
Yeah, but that's something that you take for granted, right? So we live in a place that have a great emergency, right? It's just amazing what you have with the fire department, Miami-Dade Fire Rescue, tomorrow, the system that have the helicopters, right? The police. And so every time that we need, every time they have a policeman down, or they have like a firefighter injury on duty, or a response to a school, right, to teachers or students, the response is amazing.
So the infrastructure is in place.
Our personnel is very well trained, extremely well trained. That example, I remember when they did the Olympics in Rio. I brought the people from Rio to learn with Miami-Dade Fire Rescue.
That's incredible.
Everything happened in the Olympic Games and Summer Olympics came from here. So we are really an example for worldwide way
setting
to take care of emergencies. Yes.
Absolutely. And the partnership of it all too. I know a lot of EMS and fire folks, we work with them on the PR side, but between trauma and emergency, there's a camaraderie anytime that we're in the emergency room just doing non-medical stuff. When the EMS comes through, it is like a brotherhood there.
It's a brotherhood.
It really is.
A complete teamwork. And we all realize that the situation is much greater than any of us alone, but it takes all of us to be successful. So I think there's just a great appreciation on both sides of that. Whether you're the doctor, the EMS, the paramedics, or you're the nurse, the doctor, you could see it. Afterwards, things are different. But when we're in the game, when we're about to do something that's going to affect the outcome, the lives that we have to save, that need to be saved, I believe that focus is the very best I've ever seen.
You have the same goal.
Absolutely.
And that's what he did is not because he was trained to do that.
Right.
So, I need to applaud him a lot, because being a dad, seeing a situation, a son like that.
Right.
I pray every day so I don't see my kids in a bad situation. Right. That's the only thing that I can.
That keeps you together.
I can do anything.
Right.
Except see my kids.
Right.
In that situation.
But the way he managed that, the support that he had, and and the friendship. His injury was massive, and he did a lot of work, multiple surgeries, physical therapy.
Right.
And he was always texting me, giving updates. And when everything was almost done, they were traveling in Europe, and they started sending pictures. He was walking to a canyon. Then leave the canyon, started to run. That's the kind of relationship that you became to have, because
absolutely.
Again, he was his kid, and he was going above and beyond to do that. And I really applaud him, because
I appreciate you too.
Kevin, he's a man.
He is.
Well, let's talk about this Europe trip, because and let's even go back further, right? You get bit by a shark on a Thursday. By what, Friday, Saturday, you're on media interviews and getting mic'd up. And
so basically, I mean, getting flown in from the 7 Mile Bridge to Jackson South. Obviously, straight into surgery, ICU. Was able to have a couple friends come in, I guess to calm me down and just to
feel a little normal.
Exactly.
We should mention Lieutenant Cesar Moraton was the officer on scene.
Yeah, we want to go back to that.
Yeah.
No, but I mean, he went to visit you that first day, which we have a picture.
He was the lieutenant on the scene that was at the dock, waiting for me there. And I don't know if you kind of skipped over that part, but kind of saying how
you skipped over that part, right?
Danny. Well, I was getting worked on. I was on the stretcher.
Let's hit all the parts. Let's go.
So interesting. When Danny called me to tell me, "Hey, we're back on scene," I asked him, "Hey, is Kevin? Is he alive?" And he goes, "Yeah, he's talking to the paramedics." And I go, "Let me talk to the officer." Now I'm looking at talking peer to peer, right? Officer to officer, but obviously as my son. So he goes to hand him the phone. And he says, "Sir, it's his dad." Now, as a firefighter captain on the fire department, I appreciate what he said next, which was "not right now." And the truth is that I didn't want to interfere with whatever thought process or things he was going through. And to have to explain that to someone who is not a firefighter, it takes a little bit more focus, because you've got to be careful, to give the right information. And there's a lot of developments going on, right? So you always have to be very careful. Well, the kid in his infinite wisdom, he was like this, "Hey, his dad," when he said "not right now," I was waiting for him to put the phone back on, and I go, "It's okay, I understand." But he goes, "No, man, he's a firefighter." Then I think the lieutenant was like, "Okay, I can tell this guy real quick what's going on. I don't have to explain it, right?"
Right.
So he gets on the phone. He's like, Lieutenant Moraton. And I go, "Hey, Lieutenant, good afternoon. This is Captain Blanco with Miami-Dade Fire Rescue." And he says, "Omar?"
How cool.
What are the chances? Yeah. Now, I had to apologize, because I go, "Hey, brother, I wouldn't know my dad right now if I talked to him on the phone, so you'll have to excuse me." He goes, "No, I completely understand." But what he did say, and Doc, you'll appreciate this too. You don't mind if I call you Doc, do you? He did say, he goes, "Hey, brother, I got TXA on board, and I got my own tourniquet on board." And what I knew by those few words was that this guy and his team are the absolutely best.
Wow.
That they're giving him the absolutely best treatment. And TXA is something that's new to the fire service at the time he got bit.
Well, explain what it is, the acronym.
So it's a drug, it's a medication we give via IV. There's very strict guidelines when you use it. Obviously, he met the criteria, but if you're bleeding and they're worried about controlling the bleeding, they give you this medication because it helps. And Doc, you'll be able to say more of the medical terminology, but it helps with the clotting factor, right? So that you don't bleed out. Any potential bleeds that you may not see will be controlled. Is that correct?
I would just say that we have here in Florida, in South Florida, Miami-Dade, Monroe, City of Miami, etc., the best protocol and guidelines that you have in the world right now. Every single new update, new drug, new guideline that happens, we are one of the first to implement.
Wow.
So I would say that anybody has a big injury here in Florida, coming to the trauma centers and starting to the pre-hospital, then all the way to trauma centers, then rehabilitation, you had the best chance.
That's incredible.
So that's important to everybody to know that, because not only the equipment, the medications, and especially the training that goes from first responders to firefighters, the police, the people in the hospital, the physicians, the nurses. It's one team that works well from minute zero until rehabilitation, and that's what's really special.
That's incredible. And so let's keep going through your story, Kevin, because we had talked about a little bit of the in-between, right, where you were at Omar. Now, let's say we're at Jackson South and we're meeting you, Dr. Marttos, for the first time. What do you assess first? Shark bites are not common, right? I think we all...
For him it is. This guy's done some amazing work.
But what's the first thing you look for? We've stopped the bleeding, but what comes next?
The first thing in his case was stop the bleeding. He had a big injury. He's a strong man, right?
Yeah.
And a lot of muscles, and he lost a lot of tissue. Was a big mouth, big shark, right? And then you need to first be sure that he's okay, stop the bleeding. If you need blood, give blood transfusions, etc. And you need to clean the wound, and then you need to start to do all the work. You need to see that there's a vascular injury, there's a tendon injury, muscle injury. You need to go for infection, right? There's some vibrio, need to prevent infection, etc.
Wow.
There's a lot of things that can go wrong even after stopping the bleeding. But again, that's why you have a system. Things. The pre-hospital, they have protocols, guidelines. In the hospital, is the same thing. Remember I talked about a pit stop for Formula 1 is what you do in trauma, is the same thing. We
have the system, put it in place.
Have the priorities, we're able to stabilize him, be sure that if you need blood, get blood, etc., stop the bleeding, and then go to surgery to address the main problems.
Wow.
Well, and that's a gold mine. I mean, EMS now, right? That's a gold mine. A doctor that at his level appreciates the things that lead up to when he gets the patient and kind of like engages in that conversation, because it's as a guy out in operations, it's pleasant to always hear Dr. Marttos' perspective, and I believe it's shared amongst your peers. But now I'm going to flip the script on the state rep position.
Tell us.
There's a thing called, you talk about protocols, but we have the Florida Stroke Registry, which you're familiar with. And I just went this week to present a check from the state to the Florida Stroke Registry. And the correlation to what he's saying is this is something that was started in 2014.
Yeah. Wow.
And because of the data that we have collected and the experience of all of us working together, your chances of surviving a stroke today are much better than ever in recorded history.
It is of that because around 2010, something like that, 11, 12, I was working in the state of Florida to implement the telemedicine response center. So I did like 20 trips to the Keys. I knew I needed 3 hospitals because implement telemedicine, you have like a telemedicine station.
Right.
In a way, you have somebody injury in the Lower Keys Medical Center or in Marathon or in Fisherman's, they would transport the patient to Miami, Ryder, right? And then we would receive a report through the cameras to know what the patient was having. We did some exercise with the Air Force Base like in Key West as well. So I knew very well the hospitals. And when they did the first test of telemedicine stroke, I was there.
Really?
Yeah.
Awesome.
You have people, neurologists at Jackson Memorial. They're doing the assessment for stroke on the Keys.
Wow.
And then they would send the information through video real time to neurologists.
That's incredible.
And it's amazing. I've been able to look at that program too, and I think, my goodness, we're just so blessed. I think down here. Compared to other areas that we have all these things available to us.
And the range from stroke to shark bite, I mean, it sells
cardiac,
itself, right? Now, Kevin, I want to talk to you about the recovery process because you're young, right? You're strong, you're tall.
Blessed.
Absolutely. You have a chunk of your leg bitten out, and now you have to literally stop everything in your life and recover. What was that like?
The beginning was very difficult in the way of... it's on the bottom of my leg. Yeah. It's on the top of my leg. So the first week, maybe 2 weeks at home was very stressful in the way of there was no point of comfort. Yeah. So sitting down, standing up, laying on my stomach, laying on my back, laying on my side, there was never a point, when you get home from work and you're like, oh. Yeah. There was never a sense of comfort,
You just had the FIFA World Cup here, right?
Yes.
There's soccer players and have a muscle injury. Sometimes 1 inch, they grow, there's a lot of pain. He had big chunk of muscles tears apart, missing, etc. Was this really painful,
Wow.
Yeah,
the muscle bleed and then make fibrosis. Then you start to try to walk again. It broke. You can't tell how long it would take you to walk again, right?
To walk, to get back to perfectly walking was definitely a couple months. It was, the hematoma was not comfortable. Think about like just black jelly beans coming out of my leg.
I know what it looks like.
Yeah,
it's not sightly.
It's not fun. So I guess the beginning was tough, of the fact that, again, there was no comfort. There was no like point where I could actually relax. But, I had great support from family, friends, to be able to like kind of get my mind off of it.
Because I was going to say mentally too. That's
it was
a very
exhausting.
important factor.
He had a good support network.
Good.
He's a kid that went to Columbus here in Miami. So
perfect.
The Columbus network was great.
It was awesome.
Yeah, fantastic. Even the coach, Coach Dukes, from, great guy from Columbus. They had a fishing club when Kevin attended Columbus, and Kevin and his friends convinced them to do a spearfishing club, which is ultimately, I believe,
That's
where
so niche.
it started because what they did is the program was built in teaching them the safety of the water, like getting proper. So all these boys that he was with were actually part of this whole initial thing. So how they handled it overall, whether they were freaking out or not, was textbook with how you handle these kind of situations. Because if it wasn't for them kind of keeping their cool, the one thing Kevin didn't say is after he screamed and the shark bit, the story from, I think it was Danny who was behind you, was that where was it? He froze and he freaked out because he saw what happened. He goes, I froze for like 5 seconds, and then I saw Kevin trying to kick with one leg, and then I realized, oh crap, I've got to help. So he came behind him, put his arms around him, and they all swam up together.
Wow.
But I think even even those two boys, when they showed up to the hospital, they were pale. They were like, they were just completely in shock. And I'll never forget Dr. Marttos. You might remember this, but when Dr. Marttos came out, I introduced him to the two boys. I said, "Hey, Doc, these are the two boys that helped save my son's life. We're with him in the water." And he looks down at their leg. He goes, "You two would have lost your legs because they were much skinnier legs."
Skinnier.
Yeah.
We won't call them chicken legs, but they were strong that day.
They, if you think about it, they drove the boat to the restaurant.
Yeah.
They loaded me up, put me on a helicopter, and kind of just said like,
goodbye.
See ya. So they're like
in shock,
full of blood.
And I'm sure this is their first experience in any medical setting. Right?
They get dropped off. They drop me off, and they kind of like everyone just leaves, and they were like in a shock of like, what do we do now?
Yeah.
So they obviously took the boat back, started driving to Miami, but that was tough for them. Those two boys have lived on the water, grown up on the water, just like
you did, yeah.
And they don't even own a mask anymore.
So have you been back out?
No. They probably have a time or two just to kind of like...
No, you.
Oh, me?
Yeah. You were the one that got bit.
I made him get into lobster just so he could get over that fear.
Fear, yeah. I went...
And we both slept on the couch that day at the house.
Of course.
We did mini season this past week. I had to jump in. I saw my buddies catching the lobster, and I was like, we're in 8 feet of water. They're right there. Let me get that itch out. These guys are bringing lobster left and right. I'm like, I can't just sit on the boat and play music and measure lobster. Like, I need to be in there. So
I see it as a sign of his mental fortitude, right? People are afraid of the ocean who've never even been in the ocean. Mm-hmm. So the fact 100%. That you literally dived back in head first and went to go, hopefully not head first.
No, yeah.
But you went in to go conquer it.
To go break the fear, of course.
Exactly. That's
that
testimony.
But there's a point. So the odds to get shark bite is really small.
Very.
It's easier for you to get drowning than to...
I even wrote it down here, Dr. Marttos. It's more dangerous for boats, planes, trains, cars, the sun, the cold. Exactly. All things more dangerous.
We need to learn about that and then to go over. And I know he became a celebrity, right?
Oh, yeah. Come on.
Because I met somebody some months ago say, I was talking to a guy. He was have a shark bite, was showing his leg, and that was his name is Kevin. He was talking to the guy, talking experience, etc. But that's important, Mm-hmm. So now he can teach people. Okay, you see, the people are going to be watching this podcast. They're going to say, what can I do if I have a problem? Stop the bleeding.
Stop the bleed.
Plan for problems, right? Support. Remember when you had Matthew Nunes
Yes.
from Columbus, the same Columbus had the brain bleed, right?
Yes.
How the brotherhood, the friends can help in the recovery. The same thing happened to you.
100%.
The same school, you know?
Literally the same
That's
school.
the kind of thing.
Miami's this small.
Tell me about
Miami's
it.
tiny, and everyone knows each other, and everyone, you know, the support that I had was amazing. That definitely helped a lot. But it was, you know, it almost needed to happen, because I feel like, you know, if you don't have the support and you're just home and you're like dwelling on it, you know, maybe things would have turned out differently. But having that support definitely got that out of my mental.
Yeah.
And, you know, going back out on the boat, and we went on the boat, I believe it was 10 days after I got bit, for a family spin, just to go and like
feel the air,
just to get out there, you know, because like
it's so peaceful.
it's important to us, like it's like
really
our
peaceful.
thing to do, you know. We actually just got a new boat, and the boat's name is Bite Back.
Let's go. I love that. When are we going for a spin?
We need to go for a spin.
We got to take Dr. Marttos
coolest thing.
Bite Back. So that's us, kind of, you know.
It's a comeback story.
Yeah,
you really started from the bottom of the ocean, and now look at you.
Look at now you're here.
So
100%.
I want you to leave us with something. Leave our audience with what you would tell people about your experience, right? There's tons that you've learned. You're incredibly mature. You have an incredible role model.
Thank you.
What do you tell people?
My message would be not to plan for the worst, but to definitely be prepared for anything. You know, if you stay ready, you don't have to get ready.
Yeah.
So, you know, just, again, because I wouldn't want to say, you know, think about a shark bite while you're out there having a good time. Because, again, you said how rare is it for it to happen. So, you know, you don't want to like dwell on that. And I think the whole of it being rare is, you know, the majority of, what is it, like 1 in 2 million people get bit by a shark?
It's astronomical.
That's like the whole, everyone in the U.S. or world, you know, going to the beach twice a year. Exactly. And going in Florida's a lot smaller. And then spearfishing probably makes it a lot smaller.
A lot more niche.
So it's like, but again, it is a rare thing, you know. There's a lot of things that can happen out there. So I would definitely say stay ready so you don't have to get ready.
That's awesome.
That's a good one. I'm surprised. I would have said, listen to your dad. That works out too.
He did.
But,
I did. I really did. I mean,
I was surprised. Like, oh, he does listen. But no, I would say, I would, if it's okay, I'd like to follow up on what he said. Is you know, number one, I think you know, and Dr. Marttos said it a little bit ago. You never know. You never know what the situation is going to bring, but you want to be as prepared as possible. And the two factors that I like to share with people is, the one thing I taught him in my years of running, over 20 years running 911 calls, I'd always bring that experience back and share it with people. Like, hey, man, learn CPR. Like, you know, a choking. If somebody's choking, you know, funny enough, you know, they have this suction thing that you use now to pull something if you're choking. Yeah, you should get it. I know there's a multiple vendors, so I don't want to say any of them.
Right.
But these are things that happen every single day.
Right.
And so, you know, be prepared, learn a bleed protocol, how to stop a bleed. There's a lot of things. A tourniquet is an easy thing to use. Back in the day, Doc, you remember, you could only put it up to so long, and you had to, you know, only in certain places. Nowadays, they're just high and tight. Just put it high and tight, tighten it up. As long as it stops bleeding, that's what you're going after. But if you put it on, there used to be a 2-hour time frame you couldn't use it, but as time has showed us, you can have it on for 12 hours, and there's no tissue damage, and he can expand on that. The other thing is, get the 911 system activated right away. I tell you, in that story, we probably didn't mention it, but you know, he knows because of other situations as he was growing up that he was calling me, and I go, did you call 911? He goes, no. I go, call 911, then call me back. And so that's important. And when the boys got on the boat and they said, hey, give me your dad's number, he said, call 911 and then call my dad. I think ultimately all these things that lined up that day helped save his life. And, you know, I got to give out a shout out to Danny Maduro and Chris Dones. I didn't forget their names. I'm just in the moment.
You're on the spot.
But these guys they absolutely could have seen the shark and gone up to the surface, and they didn't.
Yeah.
So
it could have played out there was a lot of factors that, you know, come into it to where you could have written the story 100 times and everything went perfect.
Yeah, it's, what do they call it? The perfect storm of everything that's
and as you wrap up and go to the main guy here, Dr. Marttos, the Jackson system, you know, we were at Jackson South, Dr. Marttos was there. I mean, that entire team, from the security guards there to the nurses to the doctors, phenomenal job. I mean, I kudos, and they deserve it, and I often say it. And the partnership between UHealth and Jackson is amazing. And so, Dr. Marttos, thank you very much.
Pleasure.
Yeah, close us out.
I would say that you have a couple lessons here, right?
Yeah.
First, for a kid, right, that grew up seeing your father working hard, sometimes not being home or getting home late because he was working, did an important job, and then you witness yourself how important is his work and the legacy that he leaves for not only for you, for every citizen in Miami-Dade, right? So that's important. And the first person that you call when they're in trouble was your dad. For my brother from the fire department, so fire department, police, trauma, we have a lot of respect to each other. You know, we are there for each other. You know, like I said, when somebody from the police or fire department is down, we go above and beyond.
Yeah.
But I would say it's just a pleasure to see our system working. I would say to every single citizen here, Miami-Dade, trust your system. You have the best system. Amazing. From the pre-hospital, from the EMS, from the ambulance guide, helicopter, and in the trauma bay, sometimes have 5 trauma at the same time. If the lady that clean the floor, taking the blood out, she's there to make things work.
Yeah.
It's security, it's blood bank, it's cleaning facilities, the nurses, the therapists, the physicians, everybody work as a team. And this only works because of that. So Omar, I saw his legacy as one of the leaders of Miami-Dade.
Wow.
Thank you.
And I saw him as a dad. So I said, Omar, to see you calling me from Europe, you want to show me he fully recovered running, was one of the best things as a physician, because to see a dad happy and a patient recover is the best. And you're here for every single dad, mom of Miami-Dade. And it's just a pleasure to serve.
Thank you.
Thank you.
Incredible. It's wonderful to have you all here to talk about your story, close out Shark Week on a positive note, right?
On a positive, you know, there's one more thing I did want to mention, just in case the right viewer gets to see this, is
speak.
I think that there's, you know, I'm not the person that would be like, you know, against sharks, because obviously we're in their territory and all this stuff.
Home.
But there's definitely a shark problem. There's a lot of sharks. There's been a ban of killing sharks and all this stuff. You know, a lot of the people that are against it, you know, don't ever really go into the water and stuff, you know, have a lot of time and experience on the water.
Yeah.
That's the reason why I got bit, but that's the reason why I'm not going back in, is because
population control. That was one of the fun facts I pulled too, that Florida has one of the highest concentrations of all the 3 big
something that needs to
biters.
Be looked at.
There's something that needs to be looked at, I think. Again, that is probably the reason why I haven't gone back in. It was a freak accident, but now it's become so much more
prevalent.
Common
for it to come up, and you know, and I see it on the news, like another person got bit, and I know what they're going through, you know, and I know that, you know, I feel like I was a lot more blessed than the people that lost a limb, you know, didn't make it, or all that stuff. So I just, you know, I think that there needs to be something done with the sharks. I don't necessarily say that like I hate sharks, you know. Obviously, again, we're in their territory, we're in their home, taking their food, doing all this.
And he doesn't like, you know, one of the best things he said when he came, he goes, I don't blame the shark. Like,
no, at all.
I'm in there. So he's not.
Course.
He's not anti-shark, and he believes that, you know, that there's a purpose for everything. But yeah, you know, there's a concern there that the waters are getting more and more dangerous, and people are seeing more and more shark activity. So I think you'll see that we'll look to see what we can do to help.
Well, we'll call you.
Make people safer out there, right?
We'll call you for help. All right, fellas. Thank you so much for your time and your expertise today. The story is truly, truly one of a kind.
Yeah.
Awesome.
Thank you.
So Shark Week may be over, but these are still good lessons to swim with next time you're in the ocean. Thank you for listening along, and don't forget to like and subscribe on your favorite podcast platform.